Hello everyone, I'm Dimutu. Today I'm going to discuss about maternal and child health, which is the sixth topic of your module. Let's see the learning outcomes. At the end of the session, you will be able to describe how maternal health affects women's lives, discuss the patterns of maternal and infant health in Malaysia and worldwide. Explain the main causes of maternal deaths. Discuss the maternal mortality in developing countries and discuss the component of integrated management of pregnancy and childbirth. Let's see what is maternal health. Maternal health is the health of women during pregnancy, childbirth, and the postpartum period. It involves not only the antenatal and postnatal care, but also care dimensions of family planning and preconception care. Now we see some facts related to maternal health. These statistics and figures are according to the World Health Organization. Every day, approximately 800 women die due to preventable causes related to pregnancy and childbirth. 99% of all maternal deaths occur in developing countries. Maternal mortality is higher in women living in rural areas and among poorer communities. Young adolescents face a higher risk of complications and death as a result of pregnancy than older women. Skilled care before, during, and after childbirth can save the lives of women and newborn babies. Between 1990 and 2010, maternal mortality worldwide dropped by almost 50%. If mother is died at the childbirth or during pregnancy, what will happen to her children and other members of the family? You have to think about that. So, how this maternal health is important? So, as a healthcare provider, it is your duty to take all the possible measures to reduce maternal mortality and morbidity. Okay, when it comes to maternal health, there are some definitions and terms which is very important for you. Those are maternal death, pregnancy related death, and late maternal death. What do you mean by maternal death? Maternal death is a death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. What is pregnancy related death? Pregnancy related death is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the cause of death. Late maternal death is the death of a woman from direct or indirect obstetric causes more than 42 days but less than 1 year after termination of pregnancy. So these are the most important definitions that you should do. You should know. Now we see what is direct maternal death and what is indirect maternal death. Direct maternal deaths are those deaths resulting from obstetric complications of a pregnant state, interventions, omissions, incorrect treatment of a chain of events resulting from any of the above. Examples of direct maternal deaths are obstetric hemorrhaging like postpartum hemorrhage or hypertensive disorders in pregnancy. In contrast to that, indirect maternal deaths are deaths resulting from previously existing diseases or from diseases developed during pregnancy and were not due to direct obstetric causes mentioned earlier but aggravated by physiological effects of pregnancy. For example, we can take a maternal death occurs due to aggravation of existing cardiac disease. I think now you can understand the difference between direct and indirect maternal deaths. Okay, these are some of the statistics and figures from World Health Organization which shows the number of maternal deaths worldwide. According to that, most maternal deaths are reported from sub-Saharan Africa and least number of deaths are reported from Eastern Asia. When it comes to maternal health, there are some other terms you should know. Those are maternal mortality ratio, maternal mortality rate, adult lifetime risk of maternal death, and the proportion of maternal deaths among deaths of women of reproductive age. Let's see what is maternal mortality ratio. Maternal mortality ratio is the number of maternal deaths during a given time period per 100,000 live births during the same time period. So, what is maternal mortality rate? Maternal mortality rate is the number of maternal deaths in a given period per 100,000 women of reproductive age during the same time period. You can calculate this maternal mortality rate as follows. You have to take all the maternal deaths occurring within a reference period. Usually we take this period as 1 year and then you have to divide that number of deaths by the total number of live births within the same reference period and you have to multiply it by 100,000. So what is the difference between these two, maternal mortality ratio and maternal mortality rate? The only difference is maternal mortality ratio you give as a ratio and maternal mortality rate you give as a rate. Apart from that, no difference is there. So, do you know what is maternal mortality ratio in Sri Lanka? According to 2017 statistics, maternal mortality ratio in Sri Lanka is 36 maternal deaths per 100,000 live births per year. Let's see what is adult lifetime risk of maternal death. Adult lifetime risk of maternal death is the probability that a 15-year-old woman will die eventually from a maternal cause. The proportion of maternal deaths among deaths of women of reproductive age is the number of maternal deaths in a given time period divided by the total deaths among women aged 15 to 49 years. Let's see how these maternal deaths happen. What are the major causes for the deaths? Those are severe bleeding like postpartum hemorrhage, infections after childbirth, high blood pressure during pregnancy, and unsafe abortions. Now we'll see what are the social determinants of maternal deaths or the factors exist in the society which affects for deaths among mothers. Poverty is the main reason. Limited access to health care, limited access to education, cultural factors including religious beliefs and location are the other determinants. Unlike in Sri Lanka, most of the people in the other countries in the world have to buy health care and education. Hence, poor people in those countries have very limited access to education and health care. So, this can contribute to high maternal mortality rate. Sri Lanka provides both the education and health care freely. That is why our maternal mortality rate and maternal mortality ratio is very low compared to most of the countries in the world. When it comes to cultural beliefs, for example, uh, in some cultures they prohibited uh, bathing after the delivery for some period of time. This is according to their cultural belief. So, this can lead to postpartum infections which cause deaths among mothers. Cultural beliefs like these can badly affect for maternal health. Now we see what is integrated management of pregnancy and childbirth. To manage pregnancy and childbirth effectively and efficiently, there should be a good health system which prepare policies and which plan resources. There should be skillful healthcare workers to manage pregnancy-related events effectively, and a community which use healthcare resources and who practice good health. So, integrated management of pregnancy and childbirth coordinate all these three. So, integrated management of pregnancy and childbirth targets health systems, healthcare workers, and thereby promotion of health. Now we will turn towards Malaysia. Now we will see what is the trend of maternal mortality in Malaysia. In 1955, there was a high maternal mortality, and when it comes to 1985, there is a drastic reduction of maternal mortality rate, and by 2010 you can see uh, it is very low. This indicates the improved maternal care in Malaysia. When it comes to Sri Lanka, it also shows the same trend. Within 20 to 25 years, maternal mortality rate has drastically reduced. This also shows the important improvement of maternal care in Sri Lanka. Now we see the maternal care delivery model in Sri Lanka. You know that it begins with caring for eligible couples. You know that after the couple got married, they have to register in the MOH area as a eligible couple. Then they will get necessary pre-pregnancy care like health education regarding sexual health, uh, conception, etc. After the woman has conceived, antenatal, intranatal, and postnatal care is provided especially by public health midwives. Then they will receive advices regarding family planning and other necessary care. Maternal care in Sri Lanka basically provided through medical officers of health areas. Through medical officers, public health nursing sisters, and public health midwives. Okay. Here in this figure you can see maternal mortality rate in Sri Lanka compared to other countries in the Asia. You can see the lowest rate in Sri Lanka, and Afghanistan has the highest rate among given countries. Let's see what is confidential inquiry into maternal deaths. The confidential inquiry into maternal death is planned to improve maternal health, and it was introduced in 1991 in Malaysia. The inquiry is used as an audit process to identify avoidable and unavoidable factors contributing to each reported maternal death. The principles of confidential inquiry into maternal deaths are as follows. First one, confidentiality is essential. Personnel involved in the management and the place of the event are not known to auditors. Second one is it should be comprehensive. Third, it allows cross-reference among all parties involved. Fourth, close rapport between various levels of care and between the providers. Fifth, not a fault-finding exercises and no punitive intention. The aim of this is to identify the final cause of death and the factors lead to death. Let's see what factors affect for the success in reducing maternal mortality in Malaysia. So these are the factors: family planning, increased professional skills of delivery attendance, upgrading the quality of essential obstetric care in district hospitals, improved efficiency of referral and feedback system, close engagement with communities, improved monitoring system are the factors affecting for Malaysia's success in reducing maternal mortality. So far we discussed about maternal health. Now we'll turn towards child health in Malaysia. Same like maternal mortality, infant mortality rate and under 5-year mortality rate has gradually decreased with the time. Compared to infant mortality rate, under 5 mortality rate is little bit high in Malaysia. Let's see what are malformation, deformation and chromosomal abnormalities. Second is the infections. Third, parasitic diseases. Fourth, diseases of the respiratory system. Fifth, poisoning. And sixth is the external causes like drowning and burns. The factors affecting for success in reducing infant mortality in Malaysia is successful immunization and newborn screening for G6PD, that is glucose 6 phosphate deficiency, and congenital hypoparathyroidism. You know that G6PD is an enzyme which regulate lot of chemical reactions in the body. When there is an deficiency of that, it can cause various problems in the body. Even it can lead to anemia. So, uh, Malaysia is looking towards sustaining reduction in child mortality, reducing inequalities, enhancing quality of care, improving health service, and upgrading facilities and strengthening access to services to improve maternal and child health further. Now turn towards Sri Lanka. You can see the congenital abnormalities is the main cause of infant deaths in Sri Lanka. This we cannot prevent. Prematurity and low birth weight is the next to that. Among these causes, prematurity and low birth weight, asphyxia, and sepsis we can prevent through proper child care. As healthcare personnel, you should be skillful to reduce these deaths among children. If you have any questions, you can direct it to me. And okay, thank you.